The best activity you can do is the one you will keep doing. And it could be different for everybody. You know, some people love going for a swim. Some people love going to the gym. Some people love going for a walk. You know, find the thing that you like. And I'm a firm believer there is something for everybody.
Welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Eamon Keogh. On this episode, we will be discussing the new physical activity and sedentary guidelines, which were recently launched by the HSE. The guidelines are there for us all to help us understand how much physical activity we should be getting on a daily and weekly basis. To talk through them and explain why they are important, I'm delighted to be joined by Professor Elaine Murtagh and Associate Professor Grainne Hayes, both from the Department of Physical Education and Sports Sciences in the University of Limerick, and are members of the Physical Activity for Health Research Group. You're both very welcome.
Thank you.
Thank you.
Elaine, I might start with yourself. Could you explain what the physical activity guidelines are?
So the physical activity and sedentary behaviour guidelines are written for professionals and practitioners who have a role in promoting physical activity. And they provide evidence-based information and recommendations so that those professionals, those practitioners are better informed to be able to promote physical activity for the public.
Right, okay. And obviously the new guidelines have been developed. Could you tell us how they differ from the old guidelines?
Yeah, our last guidelines were published in 2009.
Yeah.
That's 15 years ago. So a lot of research has been undertaken, not just in Ireland, but around the world. So what we know about physical activity for health has evolved, if you like. And also during that period, more researchers are looking at the issue of sedentary behaviour. And we didn't have sedentary behaviour recommendations in our previous guidelines. So given the 15 years of research in the intervening period, it was time to look at where we were and how our older guidelines in 2009, if they were still fit for purpose. And it was certainly time to update them. The World Health Organization, in fact, has published some key documentation in recent years, including guidelines for under fives and then new guidelines for children and adults as well. So it was timely for Ireland to update their own recommendations.
Okay. And Grainne, why is it important to have these guidelines in place?
Having national physical activity and sedentary behaviour guidelines, it's extremely important because it provides clear evidence-based recommendations to help people achieve optimal health, I guess, to prevent chronic diseases. So by having these guidelines in place, it offers a standardised approach, essentially, to promote physical activity. And it ensures that we have consistent messaging and support across communities and healthcare systems.
Okay. And that's across the whole population?
Absolutely, yeah.
And it also includes people living with disability?
It does indeed. So the guidelines that we have, there's different population subgroups covered in it when you read the documentation, and the guidelines from under fives through children, through adults and older adults, all are inclusive of anyone living with disability as well.
Okay. You mentioned sedentary behaviour. Can I ask what the significance of this is, Grainne?
Sedentary behaviour was updated physical activity guidelines. It's a key recommendation across all age groups. And essentially, I believe the inclusion of this recommendation is very important for many reasons, but particularly because there's just an emerging body of evidence to suggest that those who engage in greater sedentary time have a higher risk of attaining cardiovascular disease, type 2 diabetes, and some site-specific cancers such as colon cancer, endometrial cancer. We also have some evidence to suggest that increased sedentary time is associated with higher rates of mortality from cardiovascular disease and cancer. What you'll notice in the new iterations of the guidelines is that the sedentary behaviour recommendation, it's quite broad and vague, and that essentially is because, as of yet, there is insufficient evidence to make recommendations on the frequency and the duration of the time spent sedentary, or for the duration of breaks in sedentary behaviour.
Okay.
So they basically include a general recommendation for everybody to move and to replace some sedentary time with activity of any intensity.
Okay. So it's not necessarily the amount of time, but it's the frequency.
The frequency, exactly, and how we can break that prolonged periods of sedentary time.
Okay.
And because we used to have situations where people might be quite sedentary all week and then they're doing activity at the weekend. So we want to remind them that even if you're, going hiking at the weekend or you like go to the gym at the weekend, if you have a very sedentary job Monday to Friday, you want to start thinking about moving during the day. Just interrupt the time that you're spent sitting still, really.
Yeah. And what about, say, you're busy all day and then you slump on the couch at night? I mean, really, it's about that constant movement, isn't it? It's not...
Exactly. Just to interrupt the time you're spent sitting. So you're watching something on the TV, ad breaks, get up and move. Though loads of us stream now, so it nearly has to be a conscious, reminder to interrupt our sitting a little bit.
Yeah. And the guidelines also include a reference to muscle strengthening.
Yeah. And the muscle strengthening recommendations were there before in our 2009 guidelines, but they haven't really received as much attention until now, I would say. And that's probably reflective of public health promotion globally. It's not, it's not just in Ireland. So really what we're emphasizing here is, in addition to the aerobic physical activity that's recommended, the moderate to vigorous physical activity like walking or running, we also want to bring attention to the fact that muscle strengthening activity is really, really important because it has such an impact on your functional movement abilities. And then particularly for older adults, to maintain independence as you get older, muscle strength is really, really important. So the guidelines include a recommendation that children should include muscle strengthening activities. I think it's at least 3 days a week. And then for adults and older adults, at least 2 days per week. And maybe it would be helpful to talk about what do we mean by muscle strengthening? Often people think, that's going to the gym and lifting weights.
Yeah.
And if you do that, great, keep doing it. It's a good thing to do. But it's not just confined to that. So for children, climbing a tree is muscle strengthening. Going on a climbing frame is muscle strengthening. If you're someone who does some heavy gardening or you're lifting heavy shopping bags or repeatedly lifting a young child up, that's going to strengthen your muscles too. So a good rule of thumb is to think of anything that, your muscles actually feel a little bit tired afterwards.
Yeah.
You feel like you've worked them. That's probably muscle strengthening activity.
Okay. And just you talked about moderate physical activity there. I see it references modern and vigorous intensity. What does that mean? Or what's the difference?
It's a measure of your intensity of the activity.
Yeah.
So I suppose to communicate that would be a moderate intensity exercise would be where you can take the talk test. So you'd be actually able to complete the activity while you're talking. Okay. Then if we look to vigorous, this would be where you'd not be able to say kind of more than 2 to 3 words as you're completing the activity. You'd actually be more breathless. You'd raise your body temperature. You might start to perspire. So it's essentially the talk test that can define the intensity.
Okay. And I suppose when you talk about that intensity and you talked about the muscle strengthening, I'm just conscious we're covering the whole population here, aren't we? Is there anyone that's not included in these guidelines? Or
Yes. Yeah. And I understand the HSE is going to address this, the inclusion of recommendations for people living with chronic disease.
Right.
And also pregnant women and postpartum women. So there will be tailored recommendations published for those groups, I believe, in the next 12 months.
Okay. And for people looking for more information about the guidelines, where can they find that information?
They're all on the Department of Health website. So actually, if you just Googled "Every Move Counts," that's the title of the document. You'll find the associated resources. There's some lovely infographics that explain it. So, if someone is trying to promote physical activity within their own setting, it's a nice way to educate people. There's also a recording of the webinar we did when we launched the guidelines. That might be quite useful if some people want to learn a little bit more. And that's on the HSE Health and Wellbeing YouTube channel as well.
So looking back on the launch that we did a number of weeks ago in Dr. Stephen's, just looking at the range of age groups that attended that launch, it really does cover the whole population. But I presume there was a lot of engagement with those different groups as part of the development process. Could you give us a flavour of what that looked like?
Yeah, there was lots of engagement, and that was really key in designing the guidelines. So the research team, led by myself at University of Limerick and a range of our colleagues at other institutions, we engaged in an online consultation, and there was 2 parts to it. There was one online survey for the general public, where we were asking anyone really to comment And we shared the draft, if you like, guidelines, the draft messages, and asked for their feedback on whether or not it was clear, it was relevant to them, they could understand it. And then also they were able to provide us with general feedback as well. And alongside that, we conducted a survey for professionals and practitioners. So anyone who felt they had a role in promoting physical activity in their job. So they again gave us feedback on the draft guidelines. And once we had all that information, we then held a consensus meeting in November 2023. And there was a range of organisations invited to that. And they represented sectors, again, education, health, sport, transport, and so on. And we looked at all the feedback we got from the surveys, and that really helped to shape the language, the terminology. Also, we got feedback on what the document should actually look like, what would actually be useful to people to be included in the publication. So those three things, the 2 surveys and the consensus meeting, were really key in having that input, because you have to find out what the public think. Is it going to be useful and relevant to them? That was really important.
And without going into too much detail, but I mean, the reaction of the people that attended are from the public. Is there an openness to this? Do they understand it?
Oh, absolutely. I think people are very interested in physical activity. Where they perhaps or historically have struggled is to understand the recommendations that we're making and the guidelines, because often they're written in this very scientific academic language. That's not always easy to digest. So what we actually did in this project is that alongside developing the guidelines that a professional or a practitioner would read, we also developed what were called messages. And these are plain language lay summaries of the more scientific guidelines that can be easily understood by anyone, regardless of your training, in this area. So when you look at the guidelines publication, the document, if you're someone who's trying to promote physical activity, you can see a bank of messages that explain the guidelines in plain language terms. And that's what we're encouraging professionals to use when they're trying to promote physical activity. And we're seeing this use of messaging, physical activity messaging. It's getting a lot of research, getting a lot of attention in research circles now. We're starting to realize that in health promotion, the language that you use is really important. It can't be judgmental. It can't be lecturing. It has to be written in a way that's acceptable and understandable and resonates with people. So that's really what we've done with these updated guidelines. And I think that's a key change from what we had before.
And the messaging actually is so important, Grainne, isn't it? Because I suppose in today's society where people are driving or you're trying to work that physical activity into your day. So the simpler the message or the easier the example, the more it will resonate, I presume.
Absolutely. And I think, the every move counts is so important because it encapsulates really the whole recommendation. So it is important that they're, in terms of a communication to whatever sector, it's so important.
And also you mentioned there the range of stakeholders that were involved in the development of this. I was going to ask you about whose responsibility is to create awareness, but I presume it's a collective effort really, isn't it?
Oh, absolutely. Absolutely. And often we look at, maybe health as the body that's responsible. But yes, it is, but not just, somebody working in education, somebody working in childcare, somebody working in transport. These are all different, or sport. These are all different agencies that have a chance to encourage and promote physical activity and for the people that use their services. So that's the other thing that's tried to get across since the launch, is that it is everybody's responsibility. Lots of people can have a chance to highlight physical activity and promote physical activity in the course of their day, whether you are managing a small creche or you're the director of a nursing home. We think about the whole lifespan and where people spend their time. Of course, workplaces are a huge part of that for a lot of people. So any opportunities to encourage activity is a good thing.
And did you find, Grainne, just in terms of research, a willingness for stakeholders to get involved as well?
Absolutely. And that was very evident when we held the consensus meeting in Dublin. And this kind of stems from the World Health Organization, where they're advocating for a whole systems approach. So I think everybody was interested to share their part in actually developing and communicating, and in time, I guess, implementing the guidelines, whether you're in health, social care, education, or even sport and exercise. It's everybody has a willingness and a responsibility to implement these.
I know there's different messages across different age groups, but the underlying message is around getting us all moving more, really, isn't it?
Yeah, exactly. So it's every move counts. If that's the one key thing I think that we can take, it's every move counts. And it's quite important, while we have these guidelines and recommendations for physical activity and muscle strengthening, and there is a physiological response for health based on these guidelines. But what's really important to consider is to select the type of physical activity that you like, because I suppose we're more likely to engage in physical activity, if we enjoy it. We tend to retain or keep up the practice of physical activity if we're actually enjoying what we do.
I like the saying that, I often get asked what's the best activity I should do. Yeah. And my answer is always...
Actually, I was just about to ask you that question.
Yeah. The best activity you can do is the one you will keep doing.
Yeah.
And it could be different for everybody. Some people love going for a swim. Some people love going to the gym. Some people love going for a walk. Find the thing that you like. And I'm a firm believer there is something for everybody. You mightn't have found it yet, but there is something for everyone. And it changes, depending on where you are in your life as well, and how busy your life is. So often it's about trying different things and seeing what's available to you. And some people are fortunate enough to manage to just get enough activity through how they get to work or how to get to school. If you're able to walk or cycle or walk a portion of the way, so that's brilliant. You get your activity embedded in your day. It doesn't have to be a really separate thing that you have to think about. And I think in the last Irish Sports Monitor, that's the Sport Ireland survey that's done on an annual basis, about half of adults report walking or cycling for transport. So for commuting purposes. So that's fantastic. Another one that I always highlight is walking for recreation. So our numbers are always consistently high. I think it's around 70% of adults would say they walk for recreation on a regular basis. And then what's great about walking is we don't see the decline across ages. Often with other physical activities, we see as adults get older and go into older age, the proportion of adults engaging in it decreases. But with walking, that actually starts to increase a little bit. So walking is a great everyday option that we can engage in. So if you're not sure where to start, try a walk would be my advice.
Yeah, very good. And even you can incorporate walking, even if you get public transport, get off a stop early, all that kind of.
Absolutely.
If you're going to the shop, go to the further shop instead of the nearer shop. So there's ways of incorporating it into your day, really, isn't there?
Yeah, and that's the key, really, isn't it? Ideally, activity shouldn't be a chore. If you look at children playing, the happiness, the joy that's associated with moving. You see kids going out to break time or lunchtime at school. It's this enjoyable thing. So we don't see that as much as we get older. So if we can recapture even a tiny bit of that, it would be wonderful through finding the activity that you like.
Very good. And just for new parents listening, I see there's even guidelines for 0 to 5-year-olds. That's new, actually, is it?
Yeah, so that's new in this iteration of the National Physical Activity and Sedentary Behaviour Guidelines. So I suppose one of the key messages in it is we were recommending to limit the time that children spend on screens. I think the recommendation is just less than 1 hour or the time that they're secured in, a pram or a buggy. And, particularly for new parents, things like tummy time or even, just soft play and things like that, just to increase the physical activity.
We've had a recent episode on screen time if our listeners would like to listen to that.
And I think a lot of new parents would be familiar with that tummy time expression, putting the child down in a prone position on their belly, on the floor, something safe to get used to raising their head and then increasing that time. So they're very familiar with that. Though one thing that probably parents are less familiar with, and Grainne, you mentioned it there, are around the screen time recommendations, and they are part of the new sedentary behaviour guidelines. So actually, sedentary screen time is not recommended at all for children age 1 or less than 1.
Yeah.
So no screen time at all is the preferred one. Now, I know that might be quite challenging for some families. So even if they're working towards that, that would be ideal. And then for children aged 2 to 4, no more than an hour a day, but less is better.
Yeah. It just struck me when you were talking about screen time for 0 to 5, the fact that we have to put it in there. I mean, and as a parent myself, put the TV on for my kids as well, but just the way it creeps in as part of a daily routine, and it can be harmful.
And everyone has a screen now. Do you know, we have multiple screens ourselves. It's become so normalized. Yeah. So it's just, they're there as a reminder really for parents. Yeah. And then just to encourage more movement and, you know, getting under 5s up and moving as regularly as they can. Ideally up to 3 hours a day of play would be ideal for the under 5s.
And when we say play as well, it's nearly them, I suppose, making games themselves and
exactly. And actually
that's outdoors as well now that the weather is getting good. And
that's a very good point. When we talk about, you know, guidelines for children, because the guidelines for children is they should do an average an hour a day of moderate to vigorous physical activity. Now that sounds very serious and scientific, but what that is really saying is that allow your child to be active and to move and play for at least an hour a day. And that does not have to be organised sport all the time. Yeah. It can be out in the garden, kicking a ball, climbing a tree, whatever, running around, playing tag, playing chasing, any of those things. It doesn't always have to be in a very formal, organised manner. Many children will take part in organised sport, and that's fantastic. But as long as they're moving and are active, that's the really important thing.
Yeah, no, I think that's so important because actually, again, myself, you know, when I say to my kids, go out and play or whatever, there's that pressure to I have to come up with a game or I have to do something. But it's not. I mean, I remember my parents, you know, get out of the house, come back in 2 hours or whatever. So that has changed. So I think it's very important to give parents a break in terms of, you know, it's not organised. It's kids can play themselves and organise their own games.
Definitely. And actually advocates of play, you know, people who are studying the science of play would say that allowing children to create and imagine themselves is really important for their cognitive development as well. So letting them invent and play themselves is really useful and beneficial for them alone.
Yeah. And for healthcare professionals listening to this, what can they do to support the rollout of these new guidelines?
We would recommend that healthcare professionals kind of familiarise themselves with the key messages. And it's located in the Every Move Counts document, which can be downloaded from the Department of Health website. And it's just to familiarise themselves with the key messages and to, I suppose, communicate them to whoever they're working with. So these are really designed, I suppose, to support a diverse range of professionals and practitioners. And essentially what we would like is them to communicate the benefits of physical activity for health when engaging with key stakeholders and when advocating really for change.
From a healthcare perspective, I know a lot of healthcare professionals, as part of their daily conversations with patients, would welcome these guidelines and use them as a frame of reference. So it's great to see them launched. Yeah, and actually in the booklet, I think those graphic illustrations are really lovely and easy to talk about the different age cohorts, and that the infographics explain everything so succinctly, really, and clearly.
They do. The infographics are great, actually. They're really nice, you know, simple summary of what the recommendations are. Yeah. And then also in the document, there's key messages for different sectors. Say if you're working in education and you want to convince others of why physical activity is important, you'll find messages for your sector. It outlines, for example, the association between being physically active and academic achievement, or the benefits of being physically active and the effect it has on children actually being more focused and on task than in their classroom. Yeah. So, and we have those examples across local authority, health, sport, social care. So if you're looking for more information, depending on the sector that you're in, go straight into that document. It's all there. Yeah.
And we're coming to the end of the podcast now, but can I ask you both for final thoughts on the guidelines maybe, and what messages you'd like to remind people about?
My key message would be that it's everybody's responsibility, be that if you're an advocate of physical activity or even, you know, from a parent to a grandparent, that we now have the key messages to communicate that. So it's kind of delving more into that whole sector approach, that everybody has a responsibility. And I guess the last message I would probably share is that every move counts.
Very good. And Elaine?
Yeah, I think sometimes people are daunted about the overall expectation. You know, so the guideline for adults is that you should accumulate, 2.5 hours of moderate to vigorous physical activity a week. And if you're not doing any, you might think, oh gosh, that's so much. But if you just make a start, you try this week, okay, I'm going to go for a 30-minute walk. That's my start. And after doing that for a few weeks, you might feel comfortable to extend that a little bit further or walk on more days. So no matter, where you are on the continuum, just make a start and then try and do a little bit more, because any activity is better than no activity. And physical activity is such a powerful way of improving your health, both now and in the future. Yeah. So that tagline, every move counts, really is appropriate for everybody.
And it's free. Obviously, if you're walking and you're running or whatever it is that you're doing.
Someone can afford to engage in more elaborate types of activity and you like doing it, that's great. Yeah. But if you're not able to, any kind of activity that you can do at home, we saw during COVID, the emergence of loads of online videos or dance classes. There's an awful lot of things that are there that are free, or even going outside and walking the dog. That's the best personal trainer probably, if you have a dog that likes to walk.
And again, I suppose from a health and well-being perspective, the fact that the more physically active you are, the healthier you are, you lower your risk of chronic disease.
Absolutely. Yeah. And the fantastic thing about activity is that, you're improving your health right now in the moment. So how the effect it has on your blood pressure, your cholesterol, your mood, immediately after activity and the hours after activity. But then also the activity you do now is benefiting your health in the future. So it's like, saving for the future in terms of helping to keep you healthy as you get older.
That's great. Thank you very much for talking to us today. I'd like to thank Elaine, Murtagh and Grainne Hayes for joining me today. To all our listeners, thank you for your continued support, and please share this episode. If you would like more information about HSE Health and Wellbeing, follow us on X. Take a look at our HSE Health and Wellbeing YouTube channel, or register for our Ezine by emailing healthandwellbeing.communications@hse.ie. This has been HSE Talking Health and Wellbeing. Thank you for listening.